to the 2022 county to-do list, which is quite long, and we've already been working on, obviously, for a few months now. And then in addition to that, we're going to update you on the latest progress we've made with setting up the new Arapahoe County Health Department, which we hope to have in place by the end of this year, if not sooner. To let you know how this is going to work, if you're calling on the phone and you want to ask a question of the commissioner, you can just dial *3, and that'll put you through to an operator who will put you in a queue that will let you speak to the commissioner when we're finished with the slide presentation, which is fairly brief. And if you're watching online, you can type a question into the comments box, either on Facebook or on the website. Also, we are recording this, and the recording will be available within about 24 hours. So even if you're joining us on the phone, you can, and there's something on the slides that you want to catch or that you might have missed in the first time around, you can watch this online tomorrow. So once again, *3 if you want to ask a question of the commissioner by phone, or type it into the comments box. I'll also be asking all of you a couple of general polling questions about life in the county. And with that, I will introduce Commissioner Carrie Warren-Gully.
Good evening, and thank you so much to everybody for being here with us this evening on this chilly, cold, wintry day. I hope you're all home safe and cozy and warm. Thank you for coming this evening. We have a lot of materials to go over. And I want to start off by saying that 2021 was a very busy year for the Board of County Commissioners. And I think we're going to outdo 2021 with all of the work that we see ahead of us in 2022. So tonight we are going to be discussing a little bit about what we are going to be working on in 2022. And as Luke said, we will then go into a conversation around the work that we've been doing and planning for our public health department, our new public health department. So let's start by saying thank you. We want to say thank you very much for helping us pass our open space sales and use tax. This extension permanently of this funding will allow us and our community partners, our municipalities and our cities and many of our recreation districts, a steady funding stream that allows us to continue to acquire new open space, but also to maintain and take care of the assets that we have right now. So we will be working on that, and I think you'll be very excited about some of the work that's coming ahead in our open spaces department. We also have many different things that we do throughout the year, and we've already started that work that starts with working on, for example, some of our programming that is partnering with our nonprofit organizations in the community called our Aid to Agencies grants. We also do some youth awards. We have a National Adoption Day. We work in partnership with the Colorado State University Extension Office. And we're very excited about some of the work that is happening in our Workforce Development Center around apprenticeship programs and getting people back to work in this changing economy. We are also going to be beginning some work on reframing the way that the 18th Judicial District is set up. As many of you know, we will be making a change from having Arapahoe County, Douglas County, Elbert, and Lincoln County all part of the 18th Judicial District. It will be splitting, and Arapahoe County will be its own individual judicial district. So that needs to be completed, the work on that and the planning on that, by 2025 so that we are ready to go. And we have already started working with many of our partners, obviously our partner counties, and the judicial group down at the state capitol has been working with us as well to make sure that we're set up not only with the programming that we need to be worrying about, but also making sure that we take care of the funding side of things. That means that in our 2024 election, we will be electing a new district attorney that will only be representing Arapahoe County. We also are in the process of allocating the American Rescue Act plan dollars. That's what we refer to as ARPA dollars. And we have decided that we are going to be working mostly on supporting our vulnerable populations. We're working on supporting our area businesses and nonprofits, and partially replacing some of the county revenue that we lost during the pandemic. We're going to be refining a lot of our partnerships. As I said, not only our partnerships with our municipalities, but different businesses and organizations and nonprofits in our community, because we have some very important work to take on. We want to start addressing the situation of people experiencing homelessness in many of our communities. We want to tackle addiction, suicide, and domestic prevention programs as well. So we're going to be determining how best to serve these funds or use these funds, and also some funds that we will be receiving from the opioid settlement. Arapahoe County is going to be the regional partner for those funds. And then we are to work with our 13 different municipalities and cities to make sure that we are distributing those in an equitable way and in a way that is collaborative, and we're able to take care of as many residents in our community as possible. Next slide, please. We're also going to continue our work on our strategic plan. We have been working on that over the past several years, and we also will be focusing on the safety and welfare of our community with an increase of engagement and input from the partners in our community. We also need to address in our strategic plan an infrastructure that is aging, as we all know, and we are also growing in Arapahoe County. So we are going to need to deal with aging infrastructure, as well as how we are going to build out our infrastructure as we continue to grow in the years to come. So that will be important work in which we'll be engaging with our community. We're also going to be executing on our transportation master plan and our open spaces master plan, which I mentioned a little bit earlier. These are master plans that that spell out some of our priorities and the work that we need to do over the next 10 years in the county. And they're wonderful documents. You can go to our website and find them both there. We have received a lot of input on those from organizations that we work with. And so we're very excited about the work that's going to be happening through those master plans. We also have an election coming up this year. So that means that the county will be overseeing our June primary election, as well as the election in November. And one thing that we're always very excited about in Arapahoe County is our county fair. And this summer we will be hosting the county fair again. And we are hoping that we have the record numbers that we did last year during our event. In addition to that, we also have some work along the lines of redistricting, and many of you participated in the redistricting efforts of our congressional districts as well as our state legislative districts. But in Arapahoe County, because we serve as county commissioners as in districts, we also have to do some redistricting to the county commissioners' districts. That work needs to be done by 2023. So this election year, 2 commissioners will be up for, there will be 2 seats open in the county commissioners. That is the seat of Nancy Sharp, Commissioner Nancy Sharp, and Commissioner Nancy Jackson. They are both term limited. And so the seats for this year, or the districts for this year, will remain the way that they currently are. But by 2023, we have to have new district boundaries, which we do anticipate a little bit of rearranging of those boundaries because we've had so much growth in the eastern part of our county. And then in 2024, we will be running in those new districts. We also work very hard and have already been working very hard with our state legislators. Much of the work that happens down at the state capitol does deal with legislation that affects the county. And so we keep on top of that and work with our staff so that we can give feedback to our legislators to help them understand the impacts to our system from the decisions that they're making. And we have great relationships with all of our legislators, and they're really wonderful at working with us and stakeholdering with us. So now let's move on to our topic of this evening, and that is a new public health department for Arapahoe County. So next slide, please. Right now, we really are in the very early beginning stages of this planning, and we're really trying to start with number one, learning about the importance of a public health department and what the function of the department is. We're also really determining what are some of the programs and services that we currently offer and what would we like to see in the future. We have contracted in Arapahoe County with the Ottawa Group, and they are who we are working with as our public health experts. They have worked with many organizations over the years to give them guidance and background, and I really can't tell you how impressed I am with their knowledge base and their ability to lead us through this process. We are also partnering with TriCounty Health to make sure that we have a better understanding of what currently they are offering and what needs to be offered to our residents. And we want to make sure that everybody is feeling comfortable with how this transition is happening. There are over 400 employees in the Tri-County Health Department, and we want to make sure that we're being respectful of the fact that they are in an organization that is transitioning. So they're an incredible asset to the Tri-County Health, and we want to make sure that they are being heard and that they are having a clear understanding of what some of these next steps are for us. So next slide, please. The overall process that we're going through is focusing on the goals that you see before you. As the early part and the early phases of this discussion, we're really trying to have an understanding of what we currently offer as public health services and what is legally required versus what is optional in those services that we currently have. We're not just looking at Tri-County Health, but we're also working with the Ottawa Group to expand our understanding of services by looking at what other counties in our state do, and as well, what is happening across the country. What are some of the new trends that are happening? And historically, what are the services that are provided by public health services? We also will be looking at the governance structure of our own public health department and how that will look in the future. So let's take a look at some of the phases that we'll be going through. Our first part, the first stages of our phases is communication. We felt it was really important for our residents and our business owners and people that rely on our public health department to have a good understanding of where we are and what we're doing. So we have been meeting with several of our stakeholder groups. This is a type of educational process that we're going through. We are going to be having another town hall meeting towards the end of the month where all the commissioners will be there. I'm sorry, the end of March, towards the end of March. And we want to make sure that we're explaining to people the steps that we're taking and the decisions that we're making and why we're making those decisions. Some of those decisions have to be made for legal reasons, but a lot of them are open to this dialogue and conversation that we have with our community. We're also really trying to take a look at who the stakeholders are in this group. One of the biggest groups of people that we interact with through our public health department are our restaurants. And so we definitely want to make sure that we're reaching out and having conversations with business owners in our community. We also have daycare centers that we work with. So we want to make sure that we're interacting with them to make sure that we're providing the services they need in a way in which it's not too intrusive to them and it's quick enough and efficient enough to make sure that they can continue with their business. So I think we're ready to go on to the next slide. Let's talk a little bit about the timeline that we have. As I said, we're very early on in this process. And so when you take a look at this slide, on the left-hand side, down on the left-hand side, you will see the types of programming that are offered through public health departments. Many of you know about nutritional programs and nursing programs that we do. We also have a lot of campaigns that do promotion of health in our community and how to live a healthy life. We have environmental health programs that deal with everything from hazardous waste spills to sewers and making sure that our environment is in a healthy situation. Our emergency preparedness and response, and as you can see, obviously administrative work and any type of planning that we might need to do. So we have spent the first couple of months of this quarter really going through and looking at those services and trying to decide what ones do we want to prioritize, what ones are legally required of us, and kind of what this organization will look like as we move forward. Then when we move forward into the second quarter of the year, we are going to really try to settle on specific programs, look at funding streams that we can look to through our federal and state partners to start making sure that we are able to get funding from the services that we are wanting to provide for our residents. It will also want the third quarter, we're actually going to start getting people on board, making sure that we apply for grants and getting ourselves set up. Start the last quarter, crossing those T's. We've got everything to so that we can really stand up our health department and provide good quality services for residents by the beginning of 2023. Hopefully that answers your questions and gives you a good summary to the work that we've been doing. I think we can move to the next slide. We will be doing a lot of work around engaging with people. We've already talked a lot about that, and I've told you a little bit about our town halls that are coming up. And we also have a website that we've put forward, which I think will be very helpful for people to be able to reference and track as we go along in the decision making, and you can follow that along. I believe the next slide has that website. So if you want to go there we go. Great. So this is the, you can certainly, if you have any questions, you can certainly reach out to me and my email is there. you can go to our website at arapahoegov.com. And there is, I just went there this afternoon to double check where to locate it. But down at the bottom, there is a whole portion that you can click on that talks about the public health department and the formation of that. And if you click on that, that'll get you to a great website that'll keep you up to date on all the decisions and the progress that we're making as we go along in this process. So, Luke, I think that I've gone over everything that we had, and I'm happy to answer any questions or see what folks want to talk about.
Excellent. Thank you, Commissioner. Just so you know, your network seems a little shaky the last couple minutes. You're okay right now, but we may find ourselves repeating questions a little bit or repeating answers, just FYI.
Okay.
So, as the Commissioner said, you can go to the arapahoegov.com website, and that's arapahoegov.com/health. And that'll give you updates on the whole health department process. And now we're going to open this up to your questions and a little more discussion. To remind you, if you're on the phone and you want to talk to the commissioner about anything that she's talked about tonight, or really any county business at all, you can dial *3, and that'll put you through to an operator. It'll put you in the queue. And you can also type a question into the comments box on Facebook or on our website. And I'm just going to go ahead and answer the first question, which is, will a recording of this be available for later? And that it will be within about 24 hours. And you can find that on arapahoegov.com/town hall. So I would encourage you to check out the slides there. And so with that in mind, let's start, before we get to the audience questions, I want to start with a polling question. This is for those of you on the phone. The question is, how likely are you to recommend living in Arapahoe County to someone else? So press 1 if you're very likely, 2 if you're somewhat likely, 3 if you're neutral, 4 if you're somewhat unlikely, and 5 if you're very unlikely. So once again, how likely are you to recommend living in Arapahoe County to someone else? 1 is very likely, 2 is somewhat likely, 3 is neutral, 4 is somewhat unlikely, and 5 is very unlikely. I'll give you those results in a little bit, and then I will ask you another polling question before we leave tonight. I'm going to start with a phone question. This is from George, who wants to ask about our emergency preparedness, which of course has been a hot topic since the Marshall Fire last month. So George, you are live with the Commissioner.
Hello.
Yes.
I am a senior living in Littleton, Arapahoe County. In view of the dismal failure of alert notifications of the catastrophic wildfires in Boulder, I want to see American rescue funds used to deploy air sirens to warn our population of impending disasters. I do not want to trust my life and property on a less than perfect alert notification systems that the counties are using today.
Okay. Thank you, George. Commissioner, what can you tell us about, I know our emergency management folks have been looking hard at everything we have in place in the wake of the Marshall Fire, and we've certainly gotten some media interest about that as well. What can you tell us about what we've learned since the Marshall Fire?
Right. George, thank you so much for the call and for the question. This is a very hot topic for many of the commissioners across our state. As you said, we have had some big issues with how we do notifications. It seems to me that I remember hearing that there are actually 2 levels of notification, and we have people that sign up mostly for one where you get like Amber Alerts and things like that. And the other one that would be much more specific to Arapahoe County and would come to you with a specific, to you as a specific person in your neighborhood is one that you have to sign up separately for. We have, as Luke said, mentioned, or he's mentioned that we have had several media outlets reach out to us to have a conversation around how to start advertising this in a better way. And we've already seen that article because that's how I learned about it when I read about it in the Centennial Citizen and did go through the process of signing up for that. It is very difficult to think of appropriate systems when people need to voluntarily sign up sometimes for those things. So I'm not, it's not a good answer for you at this point, but I do appreciate what you're talking about with air sirens. And we can certainly talk a little bit with our emergency preparedness team to see about that. Part of the reason my understanding is of why some of these systems are very difficult to implement is that when you have something like that, that siren alerts to a very broad and wide audience as opposed to a very specific area that may be experiencing something. If any of you live in Inglewood, I know that that was part of what was going on when there was a potential contamination, water contamination issue, is it was hard to get it specific notifications to the area that was specifically affected by what was happening. So it is something that I know our emergency preparedness team is working on, and we have an emergency preparedness or an emergency management side of things that is housed and lives in the sheriff's department. And then, as you saw this evening, we also have TriCounty in our public health department emergency preparedness as well. So there's two teams that work together, and then of course work very closely with our stakeholders and our partners at our cities and municipalities to try to continue to improve on these systems.
Excellent. Thank you. Thank you, Commissioner. Some of our online folks are reporting that the sound is still a little shaky. If that is the case, you can, I heard that last response loud and clear, so there was no issues for me. But if you're having a hard time hearing the Commissioner, you can dial 855-436-3656 to dial it to get a phone connection. And as I mentioned, this will be recorded, and you can recap everything tomorrow. So let's move on to our next question. This is a good stage setting question that sort of recaps where we've been since last summer. This is Linda, who's asking online, Tri-County has always been one of the best public health agencies in the state. Would you please help us understand why we have to change from them?
That's a very good question. Tri-County Health is what is considered a regional health department. And anytime there's more than one county or that provides services, it becomes a regional health department, public health department. And we had Douglas County, Arapahoe County, and Adams County that were a part of the Tri-County Health Department. We did it last, gosh, it seems like so long ago, Luke. Was it last summer that Douglas County did give us notice that they were going to be leaving the Tri-County Health Department and starting their own department?
That's correct.
That's left Adams and Arapahoe remaining in Tri-County Health, which we could have continued to function as a regional health department at that point. However, Adams County, after a lot of consideration on their part, made the decision to leave the regional health department and start up their own public health department. At that point, that left us by ourselves, and that meant that we were no longer able to function as what was termed a regional public health department. And therefore, we had to, I mean, we say that we left TriCounty Health, but basically what happened was is that TriCounty Health at that point was dissolved because they didn't have more than one county forming a regional public health department. That's kind of a legal structure to that, and funding streams and other types of ways in which that organization as a regional department could function looks very different than the way in which individual departments look. So that is why we started down this process of forming our own health department once Douglas County and Adams County decided that they did not participate in a regional health department.
Yeah, and as you said, the fees, the bylaws, the legal aspects of it are different for regional versus single county health departments. And as I recall, you were meeting with Ottawa all the way back to last summer, and at the beginning, they were their scope of work was designed to look at single county versus regional, because that regional was still an option. We weren't sure yet that we were going to go solo. But once Adams made their decision, all of Ottawa's focus moved to single county. Is that correct?
That is right, Luke, and that's really what happened was we were holding out the hope that we would be able to stay as a regional department and that we could maintain that situation. But that was not the choice of the other partners in our organization. So that kind of left us having to make a decision to work with the Ottawa Group to start pursuing the path of our own individual health department. I do want to point out, it's important to point out that when TriCounty Health started, gosh, I want to say it was like 70, it's been over 70 years that TriCounty Health has been in existence. And the partners have changed a little bit in that, but if you look at Douglas County, Arapahoe County, and Adams County, and the way they looked, the number of people and residents that they had in their counties at that time, or even say 25 years ago, was very different than it is now. So that was part of the reasoning behind some of the departure on from the other counties, is that they are just big enough now that they feel they need to have services that are specific to their county and the needs that they have.
Yeah, the Tri-County Health Department overall has been around for 70 some years, and the partnership with Douglas and Adams was, I believe, 55, 56 years. But like you say, the populations, even in the last 15 years, has grown dramatically around the metro area. So it certainly changes the needs of each county. But before we move on to another question, I'm going to give you the response to the first polling question. And then just to remind everyone, if you want to talk to the commissioner and you're on the phone, you can dial *3 and that'll put you through to an operator. You can type questions into your Facebook comments or your webpage comments box. We have a couple lined up here already. Before I get to those, the first polling question, on a scale of 1 to 5, how likely are you to recommend living in Arapahoe County to someone else? 67% said very likely. 10% said somewhat likely. 10% are neutral. Nobody is somewhat unlikely, and 13% are very unlikely. As always, I would invite those of you who fall on the more negative side of the scale to let us know why, because perhaps there's something we can do to address your concerns. The best way to do that is to send us an email to communicationsservices@arapahoegov.com. And if we can't answer the question, we can certainly point you to people that will. Anecdotally speaking, based on past polls we've done and things like that, my guess for the people that are less likely to recommend living in Arapahoe is that maybe it's growing too fast. Things like cost of living, traffic, things like that might be spiking a little more quickly than people are comfortable with. But we'd love to hear from you either way. So we will ask you another polling question in a few minutes. But before we do that, let me go to the next online question. Let's see. Marcia is asking whether you, Commissioner, in the research we've done so far on the health department, do you see any advantages to separating the county health departments and going with a single county model?
Thank you, Marcia, for the question. That's a good one. I will say that I was sad to see our partnerships end. I do believe in collaboration and partnerships, and the the ability to provide some more extensive services potentially through partnerships. But I am finding too that there are some really positive things about having our own public health department. One of those being we can really direct the services to what our particular county needs. You know, Douglas County has a very different situation. They have kind of a different population. They're more rural than we are. Adams County has also a different environment that they're set up in, and different populations as well. So by being a single health department, we are going to be able to really laser focus in on what is it that our particular residents, our business, our partners need in from a public health department here in Arapahoe County. We have 13 different cities and municipalities, and they all look very different from each other. There's a lot of similarities, but a lot of differences. And so when you have a single department that can focus specifically in our county, it gives us the ability to provide what our residents and partner cities and municipalities will need in the future. As we've talked about before, Arapahoe County is growing. I think I've heard by 2030, we will probably be the largest, most populous county in the state of Colorado. And because of that, it does give us a little bit of an opportunity to be specific to our area and what our needs are versus what kind of leveling that out between different groups and different organizations like Douglas and Adams County.
Excellent. And one thing we should point out, like even though the partnership has been dissolved, all public health services will be provided by TriCounty Health through the end of this year, or until we set up the successor health department. So people don't need to worry about that. Another aspect, I think, of the sort of situation we've found ourselves in with this, as I understand it, is that we're looking for ways to innovate. We're looking for ways to eliminate redundancies of services, maybe between a community and a county. I know that Commissioner, you and the rest of the board members are meeting regularly with Ottawa to get updates about all this, and it's if not weekly, then bi-weekly or something like that. I know that the meetings are happening quite frequently, and also just to tell everyone, Ottawa is Otowi. It's not the most intuitive word to spell, so and they have a very deep experience with public health. And so they've been a trusted consultant to us in all this. Can you talk a little bit about some of the recent meetings you've had and like what goes on when you all are sitting down with them?
Sure. Yeah. So as I mentioned earlier in the program, the Ottawa Group is just I have been so impressed with the work that they've done, and they have been so helpful to me individually as well as the board as a whole, and to our entire staff to kind of start figuring out how are we going to break this down? How are we going to figure this process out? It's a big process, and we want to make sure that we're doing it in a timely way, but also being really thoughtful. So one of the very first things that they did that I thought was wonderful was to really talk about what is the function of a public health department. A public health department, the goal and the function of it is to take care of the community as a whole. When you go visit your individual medical care provider, their goal is to take care of you as an individual, to help you potentially heal or to take whatever health steps you need next. That is their function. A public health department's function is to really look at the community as a whole and see what are we seeing? What are some of the trends? So, for example, they were giving us an example of, oh gosh, I hope I'm going to remember this correctly. Uh, Symptomatic surveillance. So when you go in and are treated with a medical provider, they, if something shows up, there are certain diseases that they are required to report that they had a case of that disease. Sometimes they have symptoms that come, and we don't know what those symptoms, they're not attributable to a particular disease. And they many times will report those symptoms as being strange or unusual. And what a public health department can do is take a look at that and track that and see what is happening over the long term. Or do we see that there are a large group of these symptoms happening in Arapahoe County? So again, this is an individual doctor working with an individual, and that symptom can be looked at as a one-time thing. But when a public health department can take a look at data that's throughout the county, they can really look at it and say, no, this is more than one. This is a group or a grouping. And boy, they're very specific to a particular area. So it was interesting to kind of have them teach us about the importance of looking at a public health system versus a medical care system that we have. So that was the number one thing that I felt very thankful for, that they helped us with. They also are helping us take a look at what are best practices across the state of Colorado, what are best practices across the United States. We've also even had questions, and I know that I've asked the question of, is public health, what are they learning from the pandemic that we have been through and are currently still in? What are we learning from that? Are we seeing any trends in public health of how we want to do things? One of the answers that they have already determined is, we have so much data. How are we going to take that and break that down into a way in which we have relatable, we can explain it to people, and we can start doing that as information to help us make decisions. We are learning a lot, and we do have those meetings every single week. Not only are we meeting weekly, but our staff is meeting with them weekly to kind of start looking at, for example, our finance director is there. What are the financial implications of the types of services that we want to provide? How can we find efficiencies in our process? Do we need to hire different human resource people, or can we just pull that into our human resources department the way that it currently stands when we set up our own health department? So it's those are just a few ideas and a few things that we've been learning about. But really what we wanted to do was to define some of those values that we talked about at the beginning of the presentation, so that we could move forward in framing how we were going to make those decisions. I think we're also really realizing that we're not going to be the perfect health department year one. We are going to our goal is to have as smooth of a transition as possible, to make sure as many services that are needed are transitioned and people won't even see a hiccup in it. But there will be other things that we will need to, throughout the first couple of years, work to implement, because potentially funding streams happen at different times of the year and we miss one, or those types of things. So it's a long process, and we are trying our very best to be very thoughtful about it and to be ready come January 1st of 2023. But we also understand and that we're going to be working very deeply with our community to help them understand some of the things that may not be ready to stand up right away, and that we are working towards the future.
That's a great segue to our next question, which I will get to as soon as I ask the second polling question. For those of you on the phone, again, press the appropriate number on your keypad. The question is, how satisfied have you been with your interactions with the Arapahoe County government specifically? So number 1 is very satisfied, 2 is somewhat satisfied, 3 is neutral or it's not applicable, 4 is somewhat unsatisfied, and 5 is very unsatisfied. So again, how satisfied have you been with your interactions with the Arapahoe County government? 1 is very satisfied, 2 is somewhat satisfied, 3 is neutral or not applicable, 4 is somewhat unsatisfied, and 5 is very unsatisfied. I'll give you those results in a few minutes. Once again, if you're on the phone and want to ask a question to the commissioner, dial *3. We do have a few more people lined up and a few more minutes to get to some questions. The segue is from Carol online, who's asking, she saw an article in the Denver Post a while ago where Ottawa projected that the annual costs of funding the health department would go from $4.8 million a year now to about $8.4 million with a single county department. Carol's wanting to know, is that forecast still accurate? And if so, where will the additional funds come from?
Carol, thank you for that question. It is that is somewhat of a moving target right now, and we are working very hard to kind of figure out how that will look for us. I will tell you that the beginning projections really were to say, if we took every service that we offer right now through TriCounty Health and we stood it up and did the same exact thing for a single health department, what would the cost be? And that was what they came up with. We've already mentioned that some of what we will be able to do is to streamline some of those types of things, of admin work or management work. We are hoping that we can streamline and bring that into our current structure. So, for example, I just brought up the human resources department or our finance department and payroll. Right now, TriCounty Health has its own payroll and finance department. When we bring in and have our own single health department, we will be able to bring that into our current finance department, set that. So there are going to be opportunities to streamline and save funding as we go along. I will tell you that we have been working very hard through the Executive Budget Committee and through our budget processing to realize that we are going to have some additional expenses. And as many of you know, we run a very, very tight ship here in Arapahoe County with our finances. So we are already working on setting aside funding and looking in our budget to make sure that we've set aside a proper amount, not only for some of the costs that will happen Luke, did I lose you?
You're cutting in and out a bit. We just missed the last setting aside funds comment.
Oh, okay. So we are working very hard to make sure that we are setting up our budget to be inclusive of the additional funds that we will need. It's not going to be as much as that original projected, but we also are realizing that did I lose you again?
It's a little spotty. Well, so what I want to tell the audience is the meetings with Ottawa are mostly public, uh, which means you can view them live on our website as they're happening. We also provide recordings of them after the fact, usually within a couple of days, sometimes a little longer, depending on how much like multimedia is used and things like that. To look at the agenda for the Board of Commissioners, you can go to the Commissioners page on arapahoegov.com, and there's a link there that will point you to the meetings. So if you're interested in finding out the nuts and bolts of this and how the Ottawa Group is helping us understand the situation and how to approach the setting up of a single county health department, it's called a Legistar page. The link to that again is on arapahoegov.com on the Board of Commissioners page. Before we get to Commissioner, can you hear me?
Is that better now, Luke? I'm sorry to step away there, but
now it's better. I can hear you right now. So
great.
And we only have time for a couple more questions. I want to read the last polling question. How satisfied have you been with your interactions with the Arapahoe County government? I assume that the network problems aside tonight. Very satisfied, 50%. 32% have been somewhat satisfied. Nobody's neutral. 9% have been somewhat dissatisfied, and 9% have been very dissatisfied. As always, we'd love to hear from you about why you've been dissatisfied. The best way to do that is to email us at communicationsservices@arapahoegov.com. I'm going to combine a couple of these questions because they're related. One is who will sit on the new Board of Health, which of course we haven't decided yet. But another questioner is asking, will the members of the Health Department Board be appointed or elected? Do we know that yet?
So we have not made the decision of exactly who is going to sit on the Board of Public Health. The Board of Public Health is going to be appointed. They are not elected officials. They are appointed, and that is laid out in state statute for us as to how we do that and how many people we have on it. We do have the opportunity to expand the Public Health Board from, I think we are required to, if I remember correctly, to have 3, and we can go as high as having 7 to 9. I don't think that the tendency of the board of the county commissioners at this point is to have that large of a public health board, just for the ability of the director to work with as a larger board like that. But the exact type of people that we're going to have on that board, we are in the process of talking about that. And I think we saw in the notes earlier this evening that that's a decision that we're hoping to make in the second quarter. But we have gotten a lot of feedback about that, and we are taking that into consideration. Luke, I just want to follow up if people can hear me okay. I did want to follow I did want to follow up from that previous question about funding. What I was trying to say towards the end of that is, this is we are trying to make sure that we are being thoughtful about having a budget process that is planning for a little bit of additional funding that will be needed for our own individual department. But we are also looking at that and planning for that with the 18th Judicial District as well. So once we have our own judicial district, we will have some additional expenses around running that as a single judicial district versus a regional judicial district like that.
Okay, good clarification. Thank you. We have time for, I think, one more. Um, one of the online viewers is concerned about some of the government overreach that's happened over the last couple of years, and she wants to ensure that it doesn't happen again with the new health department, and that we are following all the science and best evidence to protect kids, families, businesses, and our communities. Can you talk a little bit about just philosophically how we're approaching what a new Arapahoe County Health Department might look like?
Yes, so we have several different types of stakeholders that work that depend on a public health department. So I want to start by saying that some structures and some parts of the way in which we set up a public health department are required statutorily, meaning that we don't have the choice to make some of those decisions or to change the way that that looks. So we are learning about what is rock solid in stone, we have to do it a certain way, and what we have flexibility about. We are also looking to try to engage as many different types of stakeholders that we have. Currently, one of our, and as I mentioned before, a large part of the folks that are served by a public health department is in our business community through our restaurants and our child care centers. And so they are, so we are interacting with them to kind of see how we could better communicate, how a public health department could include them in decision making or include them in an advisory role for, say, a public health board. We also, will continue to have conversations with our school districts. That was something that was very big and very important to have those kinds of communications with them. We are also talking with our elected officials and city and municipal levels, as well as our state level elected officials, so that we have a good communication, open communication, because we did find that that was a little clunky between the state and the counties, and then going down into our city and municipality levels. What I will say is that this was a time in our community where we had some very differing viewpoints. And we were hearing from a lot of different people that were coming from very different perspectives. People that were concerned about vulnerable people in their community, people that were concerned about their own health, people that came that felt, as the comment suggested, that there was government overreach and they were uncomfortable with that. And then we had people that said, we should be doing more. So it has been a difficult time. And I know that people have felt that, that there was overreach. What I would say is that the organization, our county, the community as a whole was learning and trying the best that they could to be protective of the health and well-being of our community as a whole. And as I said earlier on in our communications, that is the goal of a public health department, is to protect the community as a whole and to make sure that we are looking at all of the different types of residents that live in our community and the needs that they have. So I appreciate what the comment said. And we are really trying hard as we look forward to a new public health department and learn from the experience that we've had recently, not only ourselves, but the organization of public health nationally as well is trying to learn from this and make corrections and be better in the future if we gosh, I hope we don't have to face this again. But if we do, we are learning from the experience and trying to take public health to the next level and to the next step.
Yeah, that's certainly been one of the communications challenges we've faced is the fact that, according to Colorado law, public health departments have the authority to issue public health orders. And the best way to change that would be to change the law, which of course would happen at the state level. And obviously it got, a lot of that got swept up into a lot of other competing agendas and things like that. But as the commissioner mentions, we certainly hope that we can learn from all this and do it better next time. And, one of the opportunities we have here with the single county health department is to make some changes that, that will be informed by the lessons we've learned. So with that, we are at the bottom of the hour. There's one comment here from Rebecca who says, thank you for all the work you do for the county. It's been a hard couple of years, and we're so grateful for your thoughtful leadership. So with that, Commissioner, why don't you take us off?
Well, thank you everybody for joining us this evening. And I do want to express that I am very hopeful and I am very excited about the opportunity that we have ahead of us in forming a single public health department. And I see and hear that you all are very concerned about that. And I do want you to know that we want to make this transition as smooth as possible and to make sure that we are not leaving any of our services out for any of the community members that we have. So thank you for being here this evening. We will be having other conversations, other opportunities for your input. And as we said, please do go to our website. There's going to be lots of information about our decision making, as well as just getting educated and updated on what the goal of public health is in our state and in our community. So thank you for being here this evening. Stay warm, and we will see you next time.